Good Tuesday morning and welcome inside the 977 The Bolt Studios. My name is Nathan Bleckel. It's time for yet another edition of the Your Care on Mission radio show presented by the Humboldt County Memorial Hospital. This morning I have with me Diana Haverly. Good morning, Diana. How are you?
Good morning. I'm just fine.
Absolutely. Good to hear that. Diana is with the emergency department at the hospital. Today she's going to be discussing the walk-in clinic versus emergency room and the times to go to either one of those and a little bit more background information on all that. So we'll open the floor to you this morning, Diana.
Okay, thank you. Well, not every illness or injury that you have requires a trip to the ER. It's best to contact your primary care provider for your basic health care needs, your prescription refills, maybe a chronic health problem, because they do know your history, they know your allergies, they know what medications you're on, and they just know you the best. So if at all possible, it is good to use your primary care physician. But because we know health matters don't always occur at the most convenient times, we do have a walk-in clinic at HCMH, and also the emergency department is available. So you ask, what is the difference between walk-in clinics and ER departments, and how do you know which one to use? Walk-in clinics are perfect for those times when you have or develop a minor illness after hours or on the weekends when your primary care provider is not available. Walk-in clinics can provide medical treatment for minor illness and injuries such as colds, coughs, and fevers, minor cuts, earaches, sore throats, sprains, skin infections, urinary tract infections, just to name a few. However, there are certain conditions that require a visit to the emergency department. Do not hesitate to come to the ER if you or a loved one experiences any of the following, which would be symptoms of a heart attack, including severe chest pain, sweating, and shortness of breath, profuse bleeding or blood loss that continues even after direct pressure has been placed on the wound, severe abdominal pain, symptoms of a stroke, including sudden dizziness, weakness, loss of coordination, balance, or vision problems, high fever and vomiting that continues nonstop for several hours, seizures, or any injuries occurring from an accident or fall, which would be intense back or neck pain, obvious fractures or bone dislocations, deep cuts, or severe burns.
Awesome. Now, with the emergency room being operated at a much higher pace than the walk-in clinic, what are the walk-in clinic hours right now, and what are the emergency room hours right now?
Well, the emergency room is open 24 hours a day, 7 days a week. No appointments are taken. It's kind of a first-come, first-served basis, and you're also seen and cared for on a priority system that's called, or a triage system. So say somebody comes in having chest pain and at the same time somebody walks in and they have maybe a laceration. We're going to take that chest pain and address those needs right away. Every patient, of course, that comes into the ER is our priority. We will get to you as fast as we can and as soon as we can, and when it's appropriate. We do sometimes get tied up with those more critical patients. Say we have to admit them to the hospital or we need to transfer them to another facility. That all does take time, but we do realize that everybody's time is important, and we'll try to get to you as fast as we can. The Unity Point Walk-In Clinic is open at the hospital from 4 p.m. to 8 p.m. on Fridays, and on Saturdays and Sundays they're open from 9 a.m. to 3 p.m. And there are no appointments. You just walk in and register, and they will see you in the order that you come.
The emergency department, like you said, staffed 24 hours a day, so that's pretty impressive stuff. Anything else you'd like to add during this segment, Diana?
I do have some upcoming events at the hospital, if you'd like me to share those.
We'll take a break and come back to Diana's events right after this. So make sure not to change the dial, you guys, because Diana's got some awesome events coming up here at the hospital. So stay with us on the Your Care on Mission radio show.
Hi, my name is Jacob Miller, Humboldt County Memorial Hospital's new certified registered nurse anesthetist specializing in pain management. Don't let pain manage your life, and schedule your pain consultation with me today. I offer many types of pain relief, including lumbar, thoracic, cervical epidural steroid injections, medial branch blocks for cervical and lumbar back pain, blocks for knee, hip, and shoulders. Pain is unwanted and difficult to tolerate. Call Humboldt County Memorial Hospital today and ask to take your first steps in managing your pain at 515-332-7669. Referrals welcome but not necessary. Our mission is to always provide you with excellent pain management so you can get your life back. Your care, our mission.
Welcome back to the 977 The Bolt Studios, your Care Mission radio show. Nathan Blackwell alongside Diana Haverly. And now, if you've stayed with us after the break, Diana's going to enlighten us on a couple of activities coming up with the hospital, first starting with the CPR classes.
Okay, we have CPR classes coming up at the hospital. This is for family, friends, anybody who's interested in taking a CPR class. The first class is Thursday, March 22nd from 6:30 to 8:30 p.m., and this will be held in the Humboldt County Memorial Hospital conference room. And the second class is Thursday, April 5th, the time being 6:30 to 8:30 p.m., and that also will be in the Humboldt County Memorial Hospital conference room.
Awesome. So just 2 more days to get you signed up for that. Thursday the 22nd at the hospital conference room for the CPR class.
We also have a heart and stroke check coming up. That will be Monday, March 26th. This also will be held at Humboldt County Memorial Hospital. And if you want to make an appointment for that, you need to call Trinity Health Partners at 515-574-6505.
Awesome.
And then
you got a lot of them today.
I have one more. Coming up Thursday, April 12th. Mark your calendar, ladies. This is the second annual Women's Health Night Out. There will be social hour and vendors starting at 4:30 p.m., and this will go till 6 p.m., and then there will be a presentation from 6 to 8 p.m. This will be at River Valley Orchards and Winery.
Mm-hmm. Admission is free?
Yes, free admission, and
Right.
there will be appetizers, and it will be a really exciting night. The first 50 women to arrive will receive a free gift basket.
Awesome. There you go. A free gift basket included, and then topics included healthy lifestyle and diet, self-care, preventative screenings, adult immunizations, prescription and medication use, and the keynote speaker is Deidre Stanton. Do you know anything about her, Miss Haverly? No?
No, I do not.
All right, well, she's going to be the keynote speaker, so she'll be out there. Her program will be called Taking Care of Yourself, Don't Shoot Skinny Rabbits. So that sounds interesting.
Yes, it does.
Ladies, mark your calendar, as Diana said. Anything else for us this morning, Diana?
Nope, I believe that's it.
All right, thanks for coming in. This has been another edition of the Your Care Mission radio show presented by Humboldt County Memorial Hospital. You can listen back to this if you missed out, and that's on our website, 977, that's all numbers, thebolt.com. Have a great morning.